So tell us a little bit about what your life is like now.
My life now is changed with COVID. I'm talking to you from my home. My kids are in the background and my dog is by my feet, and we, are relying on technology to help keep us connected. So this ability to, do Zoom calls or, video chats with our colleagues and our patients is really, I think it's pretty cool. Actually, I'm really into how technology impacts healthcare, and I now don't mind if my like my kids are in the background or something. It's just, I think I'm like welcoming my patients into my home life in a different way, and so that's I think the biggest change. I miss my teammates, because I think we're, it's that physical connection of being next to somebody and having your lunch with somebody. And, that's hard to replace, but I think we're making the best of this situation.
Yeah, for doing things remotely and impersonally, there is a sense of intimacy when you're in your house and your kids are
absolutely
screaming in the background or
absolutely
it's happening to me right now too.
Yeah, so it's usually my dog and then other patients and their dogs start barking, and it's funny, we end up making the best of it. So but yes, it's really neat. It's actually, how technology kind of in some ways has, changed the patient doctor experience is pretty cool.
So what sorts of things are you passionate about in your career, Kelsey?
Yeah, I'm really passionate about just how we are learning so much in oncology about, really scientific molecular aspects, and how do we translate that into just talking to our patients and translating that to their care. I think it's a challenge that I find interesting. I just happen to be interested in the way obesity and nutrition impacts, cancer and cancer care. I'm also really into women's health and women's issues, and what aspects of that are involved in patient care, and also it's one of the things I actually really like about my office. We're pretty much all women in our office, and I love that. That's just that ability to work with like really strong women is important to me.
Is there something that you wish that your patients knew about you that they might not know just by looking at your bio on the website?
Yeah, I guess, that's a great question. I wish my patients knew that, I think we all really care about what we do. And I think, there's so much time I spend thinking about my patients, when after the door has closed, or the computer screen is shut down, of, did we talk about everything? Did we, is there anything that we didn't get to, or, gosh, they seem like maybe they had another question. And I guess, I'm sure all doctors feel like this, but I think it's so important for our patients to know that I think our minds are constantly thinking about them, even when we're not with them. And I think I'd love for my patients to know that that's how I feel.
Well, if I were your patient, I would feel really safe to know that you're thinking about me when we're not together.
Thanks. Yeah.
Thanks for sharing that.
Yeah. Otherwise, I love what I do. It's obviously things sometimes are stressful and moments can be sad, and there's a lot of really happy moments in what we do. And every day is different. Every patient's different, and never boring. It's always exciting and always interesting, and we're always learning too. I think that's one of the best things about what we do is it's like constant learning from each other and reading, and it's never stale.
There's never a dull moment. That's what I say.
Absolutely not. Yeah, absolutely not.
Well, thank you so much for taking the time to do this with me today, Kelsey. I know your patients will really appreciate getting to know you, and I look forward to working with you more.
Oh, thanks, Sarah. Thanks so much. Have a great day.